Hi.
Give it here. Oh, hello. So what did you bring for us today?
We want to showcase where we had a severe loss of vertical dimension, where for the upper jaw what we did is in the first place we had some kind of temporary restoration to raise the vertical dimension, and the lower jaw we extracted a couple of false teeth, made some implants and used all the implants that the patient had and had a restoration, and probably that will be the whole case.
That's his teeth.
Yes, that's what he is.
There weren't bar or anything above him.
No, that's what he has. That two teeth that probably were cleaned about a year and a half ago. The teeth are all worn out. You can see here, you even see the inside of the root canal treatment.
Yeah, you almost see to the
pink
bone.
one, yeah. You can see the nerves in every tooth.
Yeah,
you have some extensive caries.
It's
you have
not
a lot of
painful
problems.
as hell. How can he? Like it's supposed to pain. The pain was supposed to be so severe, like I don't know, a year ago, 2 years ago.
Yeah, but everything is necrotic and died.
So the pain just stopped.
Yeah, the main issue here was the aesthetical problems, and not the not from the pain but you have already extensive caries. You need to extract probably all of it. So at first what we did is we raised the vertical dimension with composite material. We just added material on top of the teeth and made the vertical dimension much bigger, probably the same as we want his final teeth as they will be. So we raised mostly the upper jaw and a little bit the mandible also, and got both of the jaws into proper relations.
So my question is, if he got used to these relations for years that he's been using them, you adding height to these relations, won't it feel weird or painful in the jaw connection? And
weird, yes, probably in the beginning, but you have two problems. First of all, you can't do anything permanent when you don't have enough space. It's just impossible. So you need to do this for the integrity of the restoration. Secondly, it's pathological what he had. So it's not good anyway. Yeah, you need to get used to a new height from the beginning.
This is the two temporary bridges.
Yeah, we had a upper temporary bridge that was made on teeth, and a lower temporary also on some of the teeth. And with the extractions, we've placed some implants on the lower jaw, so we can put back the lower temporary, wait for the osseointegration, and then switch between the old bridge and the new bridge on the teeth. After some time, we took impressions on the lower jaw. We used the regular transfers, even though we had an intraoral scanner, because it's very difficult to take impressions on the lower jaw with the intraoral scanner, because you have all the tissues and everything is moving, and for the scanner it's very difficult.
And you made the little fence for the tongue.
Yeah, we connected the composite material in the posterior side so it won't deform and break. Took it out, and we at first made it on 4 implants. We took impressions on those 4 implants. We've added scan abutments for impressions on those 4 implants, and we scanned with a laboratory scanner, desk scanner.
Is it different from intraoral scanner? I mean, it functions, that it's more correct?
It's more precise. It scans the whole impression at once. So
it scans everything at once?
Yeah, everything at once. It's a desk scanner. You don't need to. It has much less inaccuracies and problems in the final.
So why not to do everything with a...
Because with intraoral scanner, it's much less work, but you need to make sure that you can get as good result as with the traditional methods. But if it's hard for the intraoral scanner to scan because you have saliva, blood problems, movable gingiva and stuff, it's impossible to use intraoral scanner. Intraoral scanner is great for most of the cases, but there are cases, mostly the difficult ones. If you had only one implant, one restoration, one implant, it's not a problem to use intraoral scanner. You do it in a couple of minutes. It's even easier than the traditional methods. But when you want to do it on the full cross arch bridge, 12 units, lower jaw, it's a problem.
This is a temporary restoration.
This is a temporary restoration of lower jaw that right now is on 4 implants.
The span is really big.
Is huge, but it's an elderly man. There are no many forces on the bridge. We want it as a temporary restoration for a couple of months. So it won't be probably a problem. If yes, so it will break. We'll make a new one. You can see here that he doesn't brush his teeth at all. This is how he came.
After the healing process.
Yeah, it's a big problem because when the patient don't brush his teeth, you'll have problems in the future with the success rates of the implants, everything you're going to do. So you need to teach him to think about what's best for this patient. But it's a problem that I think every doctor sees, that you're doing your best and the patient don't really care.
So what you recommend, continue brushing your teeth even if you don't have any?
Yes, yeah. Always brush your teeth. Even when you have dentures, you need to brush something.
Thank you very much.
You're welcome.
And thank you for being with us today. Don't forget to like, share, subscribe, and follow to stay tuned with the latest cases. Thank you. Have a great week.